Hello. People with diabetes are at risk of developing problems with their feet. This is because having diabetes can damage the nerves and blood vessels which supply your feet. Your diabetic foot check has identified that you are at a moderate risk of developing a foot ulcer. This is because you have one of the following risk factors: a loss of feeling in the feet, poor circulation, a deformity of your foot, or skin thickening that can cause high pressure points under the foot, or that you are unable to check your own feet, for example if you have poor eyesight and live alone. As you have a moderate risk, you will be referred to the local NHS podiatrist if you're not already seeing them. You will be seen on a regular basis. It is very important to attend these appointments. To reduce the risk of developing foot complications, there are a few things that you can do. Along with your healthcare team, you need to keep good control of your diabetes, cholesterol, and blood pressure. This means taking your medication as prescribed, quitting smoking, exercising frequently, and maintaining a healthy weight. There are also some important steps you can take to manage your own foot care in between appointments. Check your feet every day. Look for any blisters, cuts, calluses, or areas of thick and hard skin. Check for infection by looking for swelling, heat, and redness. You could use a mirror or ask someone to help you. If you do find any wounds, cover them with a sterile dressing and check them every day. Do not attempt to burst blisters. Wash and moisturise your feet every day. Use warm water and a mild soap to wash your feet daily. Make sure you rinse away the soap and dry thoroughly, especially between your toes. Do not soak your feet, as this can damage the skin. When your feet are dry, apply a moisturising cream, but do not put it between your toes. Cut or file your toenails regularly. If your podiatrist has advised you to self-manage your nails, we recommend you keep your toenails short. Follow the curve at the end of your toe, using a file to remove sharp edges. Do not cut down the edges of the nail, as you may create a sharp corner which could cause an ingrown toenail. Check your footwear. Change your socks, stockings or tights every day. Avoid ones that have elasticated tops or bulky seams, as these can cause damage to your skin. Check your shoes to make sure no sharp objects have pierced the sole, and run your hand inside to check for small objects that might have fallen in. Make sure your shoes fit well and do not rub or cause blisters. Avoid walking barefoot. As the sensation in your feet could be reduced, you may not notice if you injure your feet. You may not be able to safely judge hot temperatures, so never warm your feet in front of a fire or heater or on a hot water bottle. Your nurse will be able to advise you if you have any questions or concerns about following these steps. It is important that you attend all of your podiatry appointments, as well as your diabetes review appointments. You should have at least one diabetes review with your GP every year. If you notice any problems with your feet, such as wounds that have not healed within a few days, or signs of infection, please contact your GP, diabetes nurse, or podiatrist as soon as possible.